If you've been struggling for over 2 years with horrible hip pain and you've been doing physical therapy and painkillers and shots, it's not gonna cut it. Jermaine is an awesome 48-year-old dude realtor from the Bronx and comes out here to New Jersey. And he's had low back pain that feels like a hot wire, and he's had this golf ball sized adhesion spot in his glute medius, kind of near where somebody would have hip bursitis, but a little bit more up and on the back side of his butt cheek for a long time, that he's had shots in his back for, he's had PT for, he's taken tramadol and Percocet for, the painkillers, and he's been frustrated that this stuff hasn't worked. It's been about 2 years with this, and if he's finding that it's making him depressed, so it's affecting his emotional life. So we've done our full exam. We diagnosed him with a lot of adhesion all over the place. He especially had adhesion around his hip flexors in the front of his belly. He also has a L5-S1 fusion, and so that just means that he's got a lot of gunk in the L5-S1 area. Even though it's fused, the tissue is being overused in that area because there's a lot of friction. So we've been doing a lot of that work, and then especially the superior gluteal nerve at the glute medius has been a huge resolver of that golf ball sized thing in his butt cheek. But he's 17 treatments in, and he's 98% better. He's so happy about the treatment that even though he's a realtor who he's told me, he's like, I make really good money as a realtor, he's considering going to massage therapy school to learn adhesion release methods because he's so blown away by this type of care. I love that because we have a lot of our providers, our pain doctors and therapists who are adhesion release methods providers, have been helped by somebody who does this work, and that's why they're now learning to do it so they can help other people in chronic pain. It really means a lot to me. So enjoy Jermaine's treatment.
Yeah, right side.
On the couch. That dips in like
Exactly.
this because you're on the right side.
Right, and then you're sleeping.
No pain, just a stretching tightness type of feeling.
The stretch that then agitates the nerve I'm thinking. And then, of course, when I'm sleeping in bed.
What nerve?
The sciatic nerve.
So doing this in your sleep, when you wake up with butt pain.
Well, what happens now is I tend to sleep on my left side. And then in using the pillow, instead of when I lay on my left side, you know, you see that triangle, the pillow keeps it square, so this isn't stretched.
Percentage better overall. Last time you said about 98%, 0.75.
Yeah, around about the same.
So no further improvement from last treatment?
No, because what I'm finding as well is sitting for long periods, the sofa, if I sit on my sofa, because it's not as supportive, and they tend to like sink.
Sitting on the sofa for 30 minutes to an hour.
Yeah, because the support.
What are you feeling?
Because the support isn't there, then I'm feeling that sensation of that gnawing. I'm about to go bad.
Achy.
Yeah.
0 to 10.
3, 2, 3.
Does it increase if you stay there, but you don't stay there, you walk around and move and sit down?
I sit on the floor.
That helps.
It helps, and then I'll transition back because I can't walk around all day. I have to work. Surprisingly though, walking, it's actually a joy. Because I don't have any symptoms while walking right now, except for maybe the ball of my left foot. And even that's improved drastically as well. The pain that I used to get from walking. Hold on, am I going too fast?
I think I got it. Go ahead.
Okay, the pain from walking the ball of my foot, that has improved to probably 95% better.
What do you feel?
Like I'm losing bongers.
Do you feel this? Here
No,
for both?
it's
you're feeling it more
it's
here on the side.
Yeah.
Good. Okay.
Because the thing is,
The
my
goal is-
inner smile is back because I'm not grimacing all the time in pain.
How is laying on your back? You said it would be a 2 out of 10 and it radiates.
Laying on my back.
Mm-hmm.
I woke up on my back this morning actually.
No symptoms? What'd
None.
you feel?
None.
Okay. So feel at the bottom of your rib cage. One finger. What do you feel here?
Nothing.
No stretching, no pulling, nothing. Nothing in the glute. Be specific.
Nothing.
What do you feel here?
Is the angle correct? Well, for this one, I feel a stretching to it.
On top of the thigh?
Yeah.
How much sense?
Like a 2.
One here on the left. 2 out of 10 stretch. So he mentioned having his like proximal lateral glute symptoms, and sometimes when he feels that, randomly he would feel posterior thigh and calf symptoms. When we first started coming into treatment, he did come with complaining of numbness coming down the back of the thigh and the calf.
The front of the thigh as well. Remember, the very tight feeling radiates down the front.
And when was the last time you felt that?
Sometime before the last treatment. So sometime last week. Week before last, actually.
Which is more, this front of the thigh or the back of the thigh? About the same.
Well, the back of the thigh, the hamstring is just super tight, while this would be like that what do you, limited vocabulary is coming into effect right now. With this would be super tight, and then like it radiates, and then sort of tapers off as it goes further down.
What do you feel here?
Tightness in my hamstring.
0 to 10.
4.
Increase?
Yes.
You're going at 75 degrees.
Can you stand on just your right foot for me?
What's this?
Would you feel anything?
Doesn't look like it's balanced.
Pain, no pain whatsoever.
Okay, can you stand on your
Just a
left
little
foot?
bit of.
Little bit of what?
Achy?
Little bit of. This is where something is wrong. Feeling coming back.
Okay. Can you stand on this foot? Okay, got it. Can you face that way on your side, please?
What was that?
It's seeing how one foot is doing. It's also loading the glute medius.
Would you like a pillow?
You know what? Now it's activated.
From what? From just doing that?
This position that I'm in, without you pressing. Here I'm getting that gnawing coming in.
Why is it activated? Because you're in this position?
Yeah.
And his leg is like in this triangle versus.
Because you know the between the leg pillows.
Right.
That's where that would come in, because it would keep my hips square, I think.
I did SHF to see.
Right.
Then he mentioned also having sometimes the symptoms come to the back of the thigh and the calf. That's why we did SLR. And the range is only 75 degrees, which still shows that they still have more to go.
So I'm thinking that your superior gluteal nerve is entrapped and stuck, which is a nerve that is, I believe it's underneath glute medius, but right here I'm softening it, and then when I push down it's lengthening and it's tight. So it feels like it's entrapped and stuck right in this spot, because it comes out right above the piriformis, and then it comes out this way and it branches out up high and low, and you don't seem to like this spot right here. This one's more glued up. So this one's softer, I can get in here, and this one I can't get in here as well. So success, and now we gotta go to the next spot up here, because it forks. It goes this way and it goes that way. And this one's go.
Pull the leg back.
go. So glute minimus is the smallest glute muscle, and it just needs to stabilize the hip.
Extra gravy.
Extra gravy. A lot of spicy cheese on here. Go ahead and lie on your side again and see if it's
Same
still...
side?
I want you to provoke it in every way possible. Yes, sir. It is bothering or it's not bothering?
It is. I'm feeling it in here.
Up. Here. No low back symptoms, right?
Not currently, no.
Can you lie on your side and face me again? So side lying on the left side, Casey, no symptoms, but the right side is still provoked. You were pointing up here.
Yeah. Because that's the thing. There are times when it seems to radiate all the way
From
up
the
to
low
here,
back?
all the way up to here. A couple times I felt like some tightness here, but then I'm no tradition. I tend to have back spasms sometimes, so I don't know if it was like this agitating that kind of thing.
Okay.
With the whole hip bone connected to the backbone kind of vibe.
That's right.
Ugh.
This is, I believe it's the lateral, it's iliohypogastric. It becomes lateral there, and so iliohypogastric and anterior iliohypogastric, and it's not moving well here. Lying on your right side now is gone or percentage better?
Percentage better. Like 50% better.
Is it still in the same area?
Yeah, and then right here, it seems to be like deep feeling of
Deep.
yeah,
Deep?
yeah, deep.
What was the grade of iliohypogastric and lateral grooming?
Moderate to severe. And then you said when you turned, you felt it here too?
Just lying here, I felt it.
Okay. So now I'm curious how much of this, if you say it's deep, we know you have some low back stuff going on. So stabilizing the spine, and typically that'll happen from the belly more than the low back itself, becomes a priority. Turning, did you have symptoms?
Very slight.
It was better.
Yeah.
I want to stabilize the other side of the spine because both sides are required to stabilize the spine. So that made a difference for that glute symptom, and I want to see what's going on over here. We know that he has lumbar sacralization, so his L5 is partially fused to his sacrum. And so that just means that stuff is gluing in here because he overuses this tissue.
Yeah.
So it's flexor hallucis longus tendon is on top of flexor hallucis brevis, which both of these go to the big toe.
Right here, when you press it, like a needle poked me right dead there, like a needle.
Like a needle?
Yeah. And the last week.
Last week.
Like a needle poked me through this, right in through here.
Casey's gonna measure your hips and see, just make sure we get those measurements. You're doing great. Hopefully we got that right glute medius spot that was causing your symptoms. And then if you can also stand up and see if you can provoke these feet symptoms to see if we got that any better too, that would be awesome. But don't do that yet because Casey's gonna measure your hips first. And then Casey's also gonna bring you to talk with Kim about getting a longevity package. The packages are gonna be cheaper than the cases were. We want people to be incentivized to come and see me less frequently, but over the long term, so that you don't leave for 3 years and then come back in 2027 with worse pain or as bad pain than when you started. So I'd rather see you every month or every 2 months than have you go away and then these symptoms just keep coming back. If you're really interested in learning more about fixing chronic musculoskeletal pain in 30 to 60-year-olds and adhesion release methods, our system to diagnose and treat it and actually do this work, hit the subscribe, hit the like, make sure your notifications are turned on, and stay tuned for more videos.